Good morning, everyone. On behalf of CHES BC, we welcome you to day 4 of our 2021 CHES conference. We've had a very successful conference thus far with up to 180 members who've attended at any given time. Now, most of you are members of CHES, but for those of you who aren't, we invite you to join us and take advantage of what CHES has to offer. It will be the best $150 you've ever spent. Well, maybe not the best, but pretty good. As we begin our session, I'd like to introduce Levi Strzelec and Jordan Highton, who work for Ellis Don. They worked on and are currently working on the Royal Inland Hospital project, and they are going to share with us some of the challenges working on a project of that size during COVID. So we'll turn the time over to Levi and to Jordan. We remind you as well that if you have any questions, just put them in the chat box and we will have some time at the end of the presentation to hopefully answer those. So thank you. Sorry, Levi.
Thanks, Rick. Good morning, everybody. Again, Jordan and I just want to say thank you very much for the opportunity to present to CHES and any other members and viewers that are online. We're really excited about this. We're going to take the opportunity to talk about the Royal Inland Hospital and COVID-19 and what it's been like to work through the process and through the challenges that all of us have worked through. And just, yeah, we're going to take you through a little bit of a story of where we are and how we got here and where we're going. So the agenda, we're going to do introductions. That'll be introductions, Jordan, myself. We'll discuss the Royal Inland Hospital project, just a quick overview, describing to everybody online what it is we're building here. We'll talk about COVID-19 challenges and innovations, outbreak management, because our project did unfortunately have an outbreak at one point during 2020, but again, it's not the outbreak, it's how we dealt with it and got through. We'll then discuss the new norm, and then we'll have some time for a Q&A. So Rick touched on it, but my name's Levi Strzelec. I'm the construction manager and design build lead on the Royal Inland Hospital. I've been in the construction industry since 2001, so realize now I've got a few grays and it's 20 years that I've been around. I've had the opportunity to work with many great teams, successfully delivering large and complex private partnerships, so PPP projects across BC. My extensive experience in all facets of the construction industry includes leading the construction of healthcare facilities, airports, correctional facilities, commercial buildings, and light industrial facilities. Jordan.
I'm Jordan Highton. I'm the senior superintendent on the project, in charge of the execution and construction of the Royal Inland Hospital. I've been with Ellis Don pushing 15 years and have been in the industry for just over 20. So that's me.
The Royal Inland Hospital, just be a little bit of an overview of the project. So the Royal Inland Hospital, or RIH as we call it, is consisting of a patient care tower and a phase 2 renovation. The patient care tower, or PCT, was awarded to Ellis Don Infrastructure in 2018. This is a cohesion of Ellis Don Capital, Ellis Don Design Build, and Ellis Don Facility Maintenance. Our contract for the PCT is a P3 delivery model with a 30-year operating term, which is being carried out by Ellis Don Facility Maintenance, or EDFS. The construction for phase 1 began in fall of 2018, with substantial completion in spring of 2022, February 15th to be more exact. The phase 1 includes construction of a new 9-story PCT that is located in Kamloops, BC. And for those who may not be in the BC region, that's about 3 hours northeast of Vancouver. It's constructed on the Royal Inland campus and is connected directly to the existing facility on 5 levels. The tower is a 9-story concrete building, plus rooftop helipad, as well as 2 levels of underground parking. PCT includes new clinical, administrative, and support spaces. Program components include mental health, medical and surgical beds, new surgical suite, maternal center, private labor and delivery rooms, and postpartum beds and neonatal intensive care unit. That's a mouthful. Phase 2 of the project will start in spring of 2022. It will be approximately 36 months. The Phase 2 includes significant renovations and expansions to the existing emergency departments, pediatrics, post-anesthetics, recovery, and more. Well, that's a quick overview of the project.
Now we're in the nuts and bolts of the COVID-19 challenges and what it looked like and what it still looks like to build through the pandemic. So in the early days of the pandemic last March, we found ourselves in kind of a paradoxical situation of making plans to shut down the site, but at the same time making plans to ensure that we were able to meet the turnover date of the project. So we were developing 2 plans in parallel, one of shutting down the site and what that meant in terms of preservation of equipment, protection of the construction that had been completed at that time, and just the safety of the existing building with our project attached on 5 levels being left for an unknown amount of time. The second portion of that was figuring out what we needed to do to deliver the project on time in really uncertain times. So it was a really interesting time to be in, and when we were in that time, I don't think that we were recognized that we were working on these paradoxical plans, but that's what we were doing in that time. So then it came down to protecting our workers and our business. We received the information that we were going to stay open. We were deemed essential. Construction was deemed as an essential service, so we were staying open, and it moved on to protecting our workers and protecting the business and the client's interest through really uncertain times. So our biggest challenges in the early days and continuing even to today is the evolving information and the evolving guidelines and just working with those and keeping up to date. And it became a full-time job for myself to know what the latest recommendations were by the CDU, by WorkSafe, by Interior Health, and then making sure we implemented those as quickly as we could on site, not only to be compliant, but to ensure that our workers were working in the safest possible environment.
Sorry, Jordan, I'm going to jump in just before we go too far past protecting our workers. So Jordan touched more on the site and keeping everything running and, you know, the risk that was out there, but we also had to, you know, deal with the fact that we had 22 salaried staff members on the Royal Inland site at the time. So many of them were in offices, as we typically would do, doubled up, even tripled up. And, you know, it was as everything was evolving, we had to figure out what we would do next. Again, we had to manage the fear, which all of us had. I think everybody on the call and everybody in the world at some point here has felt a little bit of fear from this COVID and the challenges that come with it. We did land up taking our non-essential workers or people that we deemed could work from home. We were able to get down to 8 salaried staff on site out of our 22. Some of that may have been our hand was forced, as I would look over at Jordan, because at one point we did have 1 of 4 superintendents on site. So there were a few of us in the project management stream that were putting on our suspenders and getting out there and pretending to be superintendents for a week or two. So we did have challenges. Again, we were learning as everybody else did, and we did what we could to keep things going, but as well make sure that we kept everybody safe. So I just didn't want us to get past without getting on that road. Sorry.
Yeah, no problem. And in the early days, we did see a reduction in manpower on site of close to 50% for almost a six to 8 week period on site. The reduction wasn't due to exposures or an outbreak. It was due to the lack of the certainty of the early information. And like Levi said, once we had our protective measures in place, really what it became about was managing the fear of our workers. So we had a lot of people off, whether they were immunocompromised themselves, whether someone in their household was, or just general fear. We saw a reduction in manpower of about 50% for a significant amount of time, which had a huge schedule impact. At that time, we sat down and we thought, we looked at, do we extend the schedule of the project, or are we able to make back the time? And given the nature of the facility being a healthcare facility, our team decided we had to deliver it on time. So we looked at ways that would help us do that to get back on track. One of those innovations that we did is we took a look at our form work, which was very labor intensive. It required a large crew of workers working really close together to cycle the formwork and to build it and to make our core dates. And we quickly did a redesign on the formwork to go to a flying table system. That design, the engineering, and the delivery to site happened in about a 3 week period of time, which is lightning fast in the construction world to get that to site that quickly. The formwork redesign allowed us to accelerate our concrete cycles. It reduced the manpower required to work on those cycles by about 50%, the exact number of workers that we had off at the time. And it allowed us to catch up our schedule on the concrete, and eventually we actually bettered the original baseline schedule and got the concrete done ahead of where we projected it pre-COVID. So that was a huge innovation, and it took a lot of people working long hours to make it happen, but we made it happen and finished the concrete successfully. The other thing, as I talked when we were working the plans of simultaneously shutting down site, but also looking at turning it over on time, we realized there was an opportunity for early procurement and off-site storage agreements. And without the buy-in of our client, IH, that we never would have had that possibility. The buy-in of our consultants, pushing shop drawing reviews and pushing design to get us to early procurement on major mechanical equipment, major electrical equipment, elevators, was huge in preventing delays further down the road.
Yeah, Jordan, you're stealing my words here, but again, it was a huge buy-in, and due to our delivery model, we were able to get ahead with our consultants and again our trade partners, and we did have huge buy-in from Interior Health. Again, right from the beginning, it was brought up in many meetings, you know, is there a possibility of getting equipment early? Is there a possibility of getting material early, getting it shipped to Vancouver, just getting our material and our equipment in production? That was really the biggest hurdle and biggest challenge that we put out for ourselves initially at the beginning. One of the other items that came to fruition from this was the off-site storage agreements. We used this for our doors and hardware, and we actually landed up procuring all of our doors, all of our hardware, and having them in Vancouver almost a year before they were required on site. But again, this gave us the ability to know that we could assure that we had the equipment and the material that we needed to perform when it was go time. So only now are we actually hanging our doors and hardware, but it was at the end of last summer when we actually were procuring everything. So again, you know, those ideas aren't necessarily new to construction, but you know, utilizing them and really, you know, it's kind of our new norm, utilizing it going forward if there's an opportunity. But again, it takes a bit of stick handling between your trades, the general contractor, and as well buy-in and commitment from the owner group. So that buy-in and that commitment is what gave us the opportunity to set up those storage agreements.
Additionally, we realized at this time that we're running an average daily manpower of close to 300 workers at this time. And so there was a lot of exercises done in access and egress for those workers. So we pushed our formwork on our stair cores so that we could get the stair cores up quicker. The actual stairs poured in the cores, which isn't typically what you do on the concrete formwork. The stairs tend to lag a little bit behind the cores. So we pushed the interior stairwells, as well as added 2 stair towers on the exterior of the building. And then these stairs became directional stairwells. So we didn't have the cross traffic in a stairwell. There was 2 up stairwells and 2 down stairwells, which allowed for a better separation of our workers. We also had to do some exercises on figuring out what the occupancy loads per floor plate were. How many workers could we physically put while maintaining social distancing on each of the floor levels? And we had to figure out, we knew the peak manpower for the site was going to be around 400 people. We had to figure out a way within the upcoming months that we would be able to accommodate physically on site those 400 people. And that was a big driver in pushing the formwork.
And I think just that gives me an opportunity there, Jordan, but I feel as though every time Jordan and his team had these quantities figured out, the square footage figured out, the rules changed, the deal changed. So it was, as quickly as we were high-fiving and celebrating our victories, the deal changed and we were back at it again and reinventing the wheels. So I think we've become very good at reassessing and reevaluating and rolling it out quite quickly. I know we did have our initial COVID plans, and it felt as though it took our team weeks to roll out an initial plan. And we're at a point now where in half a day we can revisit, get the group together, and we know what's expected and what's needed. So
we can jump down to the next slide and we'll talk about our offsite fabrication. So the offsite fabrication was built into the project pre-COVID, and whether it was a happy accident, whether we got lucky, it was a game changer in terms of our ability to execute the project. So what we're looking at here on this slide is a multi-trade rack, or as we call them on site, MTR. In all of our typical floor plates, our corridor and main rough-in was completed off-site in a large warehouse in the lower mainland. This allowed us to really separate our workers. Each station is discipline specific. So our metal fabricators would build the rack itself. They would roll on to the next station where our HVAC workers would put in the high level ductwork, and onto the next station where the electricians would put in the conduits, and so on, as you would typically see roughed in on a floor, but it was happening off-site in a modular fashion. A huge advantage to this was separation of workers, so that if we did have an outbreak, it wasn't across multi-disciplines. If it affected one crew, that crew would be removed and isolated, and we would bring in additional workers that continue to perform that work. Once the units got to site, it reduced the manpower on the floor plate by about 80%. These multi-trade racks were craned up to the floor, and then it takes 3 guys to install them. So it's significantly less manpower than if we roughed in these areas in the traditional manner. Another innovation, which was the direct result of our trade partner reacting very quickly, is we built mobile hand wash stations. So as you can see, this is a laundry sink built on a skid. Behind it is a hot water tank. And we had these built basically in a weekend and distributed to our floors, allowing for enhanced sanitation facilities on each floor. As a complement to the hand wash stations, we added additional sanitization facilities at every stairwell, at our skip hoist docks, and then at multiple locations throughout the floor. So this was a real game changer for us, with a sub-trade partner stepping up and creating something that we desperately needed on site at the time. In the early days of COVID, as you can imagine, any rental company that dealt in porta potties or hand wash stations, they were gone. They were gone so quickly. We were talking to events teams, wedding planners, anyone that supplied anything remotely similar, and they were gone literally overnight. So we had a trade partner step up and really come to the table with a great solution for us.
Yeah, again, I would take that opportunity. Our our team here, and specifically our trade partners that have been from the beginning, they've all jumped in wherever they could, whether it was our drywall contractor helping build lunchrooms, putting up temporary partitions, installing plexiglass walls, whatever it could take. Again, our mechanical contractor almost overnight had these. I know there was discussion, you know, they were starting to roll out. We were coming up with an idea, and as Jordan said, we couldn't get our hands on it. And, you know, a week later, we had at least half a dozen of them on site. So it's just, you know, it's great to see, and that's what we need to get through this kind of pandemic, right? So.
Here's an example of what our offices would look like in the early days. And I think it's interesting to note here that a lot of businesses that were deemed non-essential were shut down at this time. This wasn't the norm at this time. We kind of created it very early on. One of the really important keys to executing physical construction is the face-to-face interactions that we need to have, the collaboration around a plans table, the collaboration face-to-face on the best way to sequence, where the manpower should need to be. And this was a way that we were able to get that face-to-face collaboration that we needed, but to do it safely in really uncertain times.
So I'm gonna jump in here because maybe my eyes are a little older than Jordan's. I'm squinting, but for those on the call that are wondering possibly what we're talking about, you can see the green vertical strips, and that's actually tuck tape on plexiglass. So they got 6-foot spacings along the plan table. They got plexiglass on the edge, and then it's full height, again, to the underside of the ceiling or just below there where they've got a beam hung. So again, creating 3 separate areas so that 3 workers could be at that station at the same time, still doing their work, because at the end of the day, we still needed to come up with ways to be efficient. That's what's really been interesting about this whole outcome, is that, you know, we did have to work with safety and, you know, the safety of all of our workers and all of us, but we also still had a deliverable in the end. So it was always an initiative to come up with ways to still be productive. And I think some of these, you know, Jordan will hit on them later, but I believe that some of these items are going to stick around for quite a while, and really it's just adding to the quality of life on a construction site.
I think Levi touched on a point there that's a little bit nuanced, and that's that when we decided that we were going to deliver this project on time, there was no backdoor, there was no escape route. So we gave IH our word, and we gave our senior management our word that we could deliver this project on time. So these type of innovations they had to happen, and we spent a lot of hours talking about how we could get the interactions we needed, how we could get the personal time that we needed, because once we gave our commitment, we weren't going back on it. So yeah. So despite everything that we had in place, the social distancing, the masks, we did have an outbreak on site, and it had a huge impact. I think they were probably the longest, most stressful days of my career when the outbreak was declared, and mostly it's because there's no playbook. If there's a fire on site, if there's a flood, you know, there's a playbook for how you deal with those things. You know who to call and you know how to manage it. But with an outbreak, there was no playbook, and so it was very stressful at the time. And one of the huge benefits, or one of the things that really saved us and kept us building through that outbreak was the input of IH. We were in direct contact with the CDU. We were on calls very frequently with both IH and the CDU, determining that the site was safe, if it was safe, and how we were going to move forward. So the benefits that we had in place during the outbreak is we had on-site contact tracing set up very early on, because we knew that there was a probability or possibility that we would see an outbreak.
Sorry, I'm going to jump in on my contact tracing. So in no way, shape, or form did we believe on site that we were going to manage that on-site tracing, or in any way imply that we were doing that work for the province or Interior Health. It was just something that Jordan and the team kind of dreamt up and said, well, why can't we track what's going on site? Why can't we try to get ahead of it? And, you know, as the wheels get turning, hopefully we're already a little bit ahead of the curve. So I need to go ahead and throw that in, Jordan.
Yeah, you bet. And part of that contact tracing is in the early days, as we were building additional lunchrooms, as we were kind of going through all the measures we needed to put into place. We started building a mapping system, and that mapping system consisted of where each worker sits in their respective lunchroom, who they sit beside, who they sit across from, and those people were turned into cohort groups where they would work on the same tasks or in the same areas. And so we made a very conscious effort to keep groups clustered in terms of what the risk of their exposure may be. So when we started getting positive cases, we could look at the employee mapping or the lunchroom mapping, and we could know very quickly who was likely a direct contact with that person. That direct contact would then be isolated from site for a period of time to assess whether they started to develop symptoms, and then pending further testing or waiting for IH or the CDU to actually reach out to that person when their contract tracing was complete. So we started isolating workers who were deemed as direct contacts prior to receiving the actual formal direct contact. And this went a long way to really keeping our sites safe and preventing the outbreak. On top of the on-site contact tracing and employee mapping, we really have to have an understanding. Being an out-of-town job, the bulk of our labor pool is drawn from the Lower Mainland and even out of province with some of our specialty installations. So we had to understand how these workers were getting to and from work, what their housing situations looked like, were there shared accommodations, and if so, with how many people, and how was that being managed? So never in my life would I have imagined that you know, the reach of my job scope would go into people's personal lives or housing or their commuting to and from work. But for the safety of the project and the ability to deliver on time and the safety of our workers, we needed to understand all that stuff. So
I think just to kind of touch on, you know, as the provincial guidelines would change and evolve, our approach would also change and evolve. So I think, you know, what you may see in a photo or, you know, what you may hear from this conversation is, you know, it's evolving as we go. It may have been something that was, you know, acceptable 2 months ago or yesterday, and again, has changed. You know, no different than Jordan and I today sitting 6 feet across from each other. You know, we're getting there, and hopefully this is getting wrapped up. But again, it's kind of that evolution that we've had going. I think one of the other key items that Jordan didn't give himself enough credit for was the fact that the daily COVID updates, and I believe the open book that Jordan was. So in the start of our outbreak, Jordan started sending out daily email updates to all of our trade leaders. This would say any new cases, any cases that were returning back to work after their 14 days, and again, any other knowledge that we had picked up from Interior Health or anybody else that was involved. So it was all hands on deck. I think one other kind of note there, we did at the beginning of the outbreak engage WorkSafe BC. Again, as Jordan said, Interior Health, and we brought everybody on site, those that would come, others virtually, but again, to analyze what it was that we had, just to make sure that we were doing everything that we felt we could do. To add a little bit more perspective, and we won't go into any further detail than that, but our outbreak actually started from an off-site. So it was not started on our site. It was brought to our site from a group of cohorts. Again, as Jordan said, we had to adapt and start asking questions that we've never asked before. I've never sat in a contract award and said, you know, will your workers be living together? You know, those sorts of questions. So I think, you know, we want to put a little bit of perspective to that. It was very complicated, but again, the systems we had on site were working for us. The one other major that we actually Jordan and I never even discussed, but it came to me as he was talking, was Ellis Don as a corporate, as the company rolled out mandatory masks the week that the outbreak started. So that Monday we rolled out mandatory masks on site. I believe it was Thursday or Friday when I got the phone call from Jordan that we had our first case. It was actually Friday night. And again, there was a large belief from the, the powers that be, the people that have that sort of knowledge, the interior health folks, that really slowed the spread for us. So, there were some lucky moments along the way. Definitely, we'd love to take credit for everything done, but quite often, we get a process going and it just happens to be perfectly timed. So that one I think is one worth mentioning, that the masks definitely helped us out.
Yeah, post-outbreak or during the outbreak, it became really clear through our dealings with IH and this TDU, like Levi said, that the cases were being brought to site rather than transmitted throughout the site. So we got assurances from experts in the field that everything we were doing on site was safe, and it really became about managing the fear of the employees on site. And that was the genesis of the COVID updates and the transparency of the information that I was delivering to everyone on site. As a complement to all those things, we did a deep cleaning. We shut down site for 2 days, and we brought in a contractor to do a deep cleaning of site. And basically it was a fogging of site and then a wiping down of every touchable surface that we had on site. And throughout this whole period, we have a dedicated cleaning crew that runs a 10-hour cycle of wiping down every high frequency touched area, every common touched area. So we do have a large crew of people that spend their day on site just cleaning these touchable surfaces and any common areas,
including all of our staff trailers and our off-site office. So
yeah. Another interesting thing that came about during the COVID is reviewing the safe work procedures. So through the outbreak, we wanted to make triply sure that we were not only meeting the guidelines, but in any case possible exceeding the guidelines. And that required us to take a look at the safe work procedures for almost every task that happens on site. And as we were going through that process, it was shocking. I don't think you realize how many tasks on site take 2 workers working very close together, from hanging plumbing pipe to installing conduit to ripping plywood on a table saw. And so it was really an interesting exercise in how do we separate these workers and provide them the safest work environment possible, but still complete these tasks that require 2 workers. And in some cases it's specialized PPE. In other cases it was changing how we perform that work. So yeah, it was an interesting exercise to go through that, and something in all my years of construction, I was shocked at how many jobs take 2 to 3 people.
So the new norm.
Yeah, the new norm.
Well, I guess the new norm, let's start with the return to work for all of our employees. So that was a challenging process. Again, you've got to play that line of, we have to keep everybody safe and do everything we can to ensure that everybody's safe, but we also have to continue to do the business that we do, which is building this building. We in March landed up going down, as I touched on earlier, to a much smaller management crew where we could. Again, some of our coordinators, and then we had our project managers on a rotation, just trying to minimize the amount of people on site. It was finally in June of last year where we started to do our soft rollout to get our staff back to site. Again, I touched on it earlier, but we had to totally reinvent our systems here. We had to get more offices. We had to put up temporary walls, which are still up if we had any offices where we had 2 people. Again, we did the square footage and ensuring that we had a certain value or certain amount of people within that room. But again, this all took time. And last summer, as we all know, COVID obviously slowed down and it was much more comfortable. And then we had the second second run of COVID. So it was back to where we could, having workers work from home. And truth be told, we still do have a couple of workers that are working from home. We're, eagerly working to get everybody back on site as we are in the last 7-8 months of the project. So, we need all hands on deck, but again, we need to make sure that everybody feels safe and that everybody is safe when they return to work.
One of the challenges that we felt with removing kind of our management team from site that were deemed not essential to physically be on site is the perception from your trade partners on site. It's, you're telling me the site's safe, but half of your people don't even work from the site. And so that was a really difficult thing to manage, and you kind of are stuck in this situation where they're saying, well, you say it's safe for me, but you're not telling your own people it's safe. So I think the rollback and bringing our people back to site was critical in leading from the front and showing the workers that, we believe the site's safe. We're bringing our own people back. They've managed to work from home successfully for weeks, but we want to show you that we believe the site's safe, and we're going to lead from the top. So I think the timing of that was really critical to continue to build confidence in the trades in really uncertain times.
Yes, I think the virtual meetings and building through virtual meetings, I mean, Jordan and I, we've had some challenges along the way here. We, as everybody, whether it's Skype, whether it's Google, whether it's whatever it is that's out there that you're using, it's very easy to run a meeting and have an effective meeting. What we were finding tough was the inspections and sign-offs and that sort of thing. So building through the virtual meetings has definitely worked. I've actually found, there's definitely areas where it's become more effective. Everybody on this call, a year ago, 2 years ago, for sure, there's no way we would have thought this would be effective. And, right now, Jordan and I are somewhat holding this presentation together. So, I think we've all come a long ways in the last couple of years or year and a half through this pandemic. But building through virtual meetings, we've had to have virtual inspections for architectural inspections, virtual for mechanical, electrical. I think one of the more interesting that Jordan and I were talking about was our acoustics consultant. So our acoustics consultant, which is our walls and soundproofing, is based out of Toronto. And of course, last year there was no traveling from Toronto. Even at this point, we haven't had any visits on site, but we still had to sign off walls, work through problems, and it was tough at first. We were sending photos, long-winded emails, and everything gets lost. So we landed up running our Google FaceTime.
Yeah, so there was a ton of confusion about the extent of our acoustic barrier and where it needed to go. And as Levi said, it was going back and forth with zero productivity. So we decided one day, Levi and I went out inside and we said, let's just FaceTime it. So we FaceTimed it. And we ended up doing about an hour-long inspection. And truthfully, we did a bit of design at the time because we realized that the as-built conditions weren't necessarily reflective of the design documents. But to hold a FaceTime meeting and say, do we need to go an inch higher or an inch lower, or do we wrap it further around, became our most productive way to solve a lot of these challenges. And from that day on, and again, that was early days, we've held so many FaceTime calls with consultants, with trade owners, with foremen, and it's been a really productive way to kind of solve these challenging problems where a photograph doesn't give you the whole picture. So yeah, that was an innovation. I think I FaceTime my kids and my family, but I never thought of it as a business tool. And it became huge for us in executing on the project.
And it's definitely one of those, as we all evolve and we start to move towards virtual reality, likely in headsets, that sort of thing, I'm sure will be in our future. I think this pandemic has definitely sped up the process in construction. Like construction, most of us that are involved in it, there's certain areas where we're still slightly archaic or a little slower than other industries. So it's great to see this sort of thing picking up speed. And you know, it's only going to make it better for all of us. So
yeah, and one of the most challenging aspects and highest risk aspects in our job is the rooftop heliport. And I don't know if anyone in the audience has ever built a heliport or been involved, but the regulations and the requirements through Transport Canada are strict, and there's many of them. So we have a heliport consultant on our project that assisted us in the design and the execution. But to be able to get up on the pad and have a FaceTime call with that consultant and show them the progress of what we were doing and the challenges that we were having, it's huge in minimizing our risk and being able to get the sign off from Transport Canada and the certification in a timely manner on the helipad. So yeah, we used it to great effect on this project. Redevelopment of safe work procedures. As Levi touched on, in many ways, the construction industry is archaic in terms of on the execution side, in terms of construction processes and efficiencies that have been gained in the last 20 years. It remains virtually the same. But when we are forced to sit down and look at safe work procedures and develop them, we realized how many tasks we were doing with multiple people that we could figure out a way to do them with less people and safer and more effectively. And that exercise would never have been forced without a pandemic. No one would have ever sat down and gone through 500 pages of safe work procedures and said, hey, is there a way to do this that's better, that's safer, and requires less people? And I think we gained a ton of efficiencies in that process outside of just worker safety. So some of that, sorry, I'll just touch on one. I think, again, falling back, anyone who's done a site visit at lunchtime has seen what the site lunchrooms look like. And, you know, it was nothing for my career in construction, it was nothing to put 40 workers in a lunchroom side by side by side. It was also, in my honest opinion, and I'm guilty of it my whole career, I don't think that we offered our workers necessarily the best hand washing and hygiene facilities. And I think moving forward, I don't see that leaving construction. I think we've established a standard now that not only will workers expect moving forward, they should expect it moving forward. I think we were way behind the times in terms of the facility that we offered the people that execute this work. And I think we'll see it stay. I think that runs through for the rest of my career in construction for sure.
We're going to make it stay.
Yeah.
Right. So again, you know, we have these events. We've got our beam signing here, which was last year, early summer, I believe. But again, that's the challenge with this pandemic. And again, you know, most of us are very social. We want to socialize. We want to celebrate our victories and, you know, our accomplishments. So I think this has been an item that we threw this up and wanted to close with this because we are in our home stretch on our project. And we know that our client and our trades and everybody are really eagerly, you know, we're going to complete this project on time. Everybody's going to be successful, but we need to find the time to go ahead and enjoy and appreciate our victories. So we are working with our client and again, our trade partners, and even internally to start to, as the province opens up, start to celebrate, start to enjoy these victories. Because I think that's been one of the biggest, for me anyways, you know, this year has been tough as far as not being around people. Most of us that, you know, get into construction or get into these sorts of positions, you're a very social person. I'd rather be here building than sitting at home building from a computer. So it's been challenging on that front, but we're definitely looking forward to, again, more celebrations of our victories to come here.
Yeah, I think Levi said it perfectly, and yeah, it'll be great when we can do that.
So now we're complete. We're 1 minute ahead of schedule. Any questions or answers, or I'll leave it to Rick.
All right, we have one question here from Glenn, and this was regarding your lunchrooms. He says, we've learned lunchrooms were vulnerable places for staff. Did you have dedicated lunch break rooms? If yes, with how many staff? How did you maintain physical distancing? Did you stagger your coffee and lunch breaks? was the organized seating arrangements, and what was the maximum staff occupancy in these spaces, and were they well ventilated? So that's a lot of questions there, but we'll see what you can come up with.
So yeah, that was a lot of questions. And so each, we ended up building an additional 29 lunchrooms on site. And each lunchroom was measured and verified against the CDU guidelines in terms of square foot per worker required. And that occupancy was posted on the door. So each lunchroom had an occupancy sign posted on the door of how many workers were allowed in that lunchroom. And as I discussed kind of earlier on, we had employee mapping and lunchroom mapping. So we knew which workers sat in each lunchroom for each discipline. And those workers didn't change. There was no going in between lunchrooms. You had your seat in your lunchroom with your partners. And there was staggered start breaks, staggered lunch breaks, staggered coffee breaks, because we physically didn't have the room to build enough lunchrooms with the allowable spacing per worker. And then in between each of the staggered breaks, our cleaning crew goes in and cleans those lunchrooms after the initial shift leaves it and before the next shift of workers arrive to that lunchroom. So I think in the time since we built those lunchrooms, the occupancy load in those lunchrooms has changed, I believe, 3 times, and not getting smaller. It started small, it got a little bit bigger and had to be reduced. And the interesting part that we found is we were getting that information from the CDU's website versus what was being told over the news reports. And so the information we were getting was being updated on the CDU website, which we were reviewing weekly to see what changes and how much square footage we were required per worker. And that was no different with our floor plates. We were constantly monitoring the number of workers allowed on each floor plate.
Okay, that's great. Someone asked this question, but I think it's pretty obvious. They were just wondering if there's plexiglass between the two of you, but I don't believe there is. So does that mean that you must be in one another's bubbles?
Levi, our cohorts, yeah, we've been, since the early days of this project, given the challenges, we basically had to become cohorts. We were spending long hours late at night at work trying to figure out our path forward and if there was a path forward, and have since remained in each other's bubbles, both professionally and socially.
Okay, good. I have a question for you then. So what do you think were the direct costs associated with dealing with the COVID outbreak with regards to lost wages for your workers and those types of things? Additional protocols. How much extra do you think that added on to your project?
Dollar figures?
Yeah, dollars, I would think, if you know that.
I won't know exact, but it's hundreds of thousands.
Okay.
Yeah, we have a baseline pre-COVID of our monthly spend, and then with the enhancement of the cleaning crews, the additional lunchrooms, everything that we've added, we carry a column outside of our initial budget, and it's hundreds of thousands of dollars it's been costing us to continue running.
We've been running at about 70,000 every quarter.
Wow.
So it is, but it's what needs to be done to keep our site safe and to keep the construction moving on. So
I think in a different circumstance, if it wasn't a healthcare facility, we would have sat down if we were building a warehouse and looked at the viability of continuing to spend that money to push forward. But there's an urgency and a need to get this hospital up and running for the community and as a support facility for outlying communities. And it was a no-brainer. It didn't matter the spend. We didn't know initially what the spend was going to be. We just started doing it, knowing that we had to get this across the finish line.
Okay. So a follow-up question to that from Kenny. Are the additional COVID measures paid for by the owner, or are those incurred by Ellis Don?
I'm going to tap dance around that question. I think we are definitely working with Interior Health. They've been extremely fair, and they are in the same boat as us. They want to see this project done. So I think that's my best safe answer for everybody.
Okay. There's also a question from Leon. He says, what did you do to safely distance during daily or weekly site safety meetings, which can sometimes include hundreds of workers at one time? So how did you manage that?
Yeah, you bet. That's a great question. We started holding them virtually. Yeah, that's how we managed it. In many of the meetings, I would be, because there's a lot of safety messages that I think have to come from me directly to the boots on the ground workers, and not necessarily through their direct supervisor, whether they work for Ellis Don or whether they work for our sub-trade partner. And there was multiple occasions where I spent 4 hours of my day cycling between virtual meetings of small groups of people to deliver the message that needed to be delivered. And so that's how we managed it. In terms of our daily coordination meetings with our trade supervisors, it continues to evolve. Currently, we're doing it virtually. There was an occasion where we were meeting in a large space at the end of the day once the workers had left the building, on the outside of the building, and we were holding those face-to-face meetings outdoors on site. But as the phasing of the project changes, kind of the effectiveness of those daily meetings changes as we get to different phases in the project.
Okay, we have a question here from William as well. He says, do you think a project of this size and nature would have been affected differently if it wasn't an institution owner like Interior Health? More significant delays, maybe even just putting it on hold for a short time? Do you think that would change?
Yeah, absolutely, it would change. I know of other projects going on in the region that are heads and beds type projects where construction needs to be complete to start generating revenue that covers the construction essentially. And those projects were shut down because the efficiencies got so low that it wasn't worthwhile anymore to run those projects. So I think us being a healthcare facility was a huge factor in being able to continue to push the project on, especially in the early days when there was so much uncertainty.
And to add to that, I think it would have been easy, and there were many times where when Jordan and I would close the door, we would say, like, what are we going to do going forward, or how are we going forward? Like, it's easy now when we sit and do a nice little sit down presentation with everybody and we've gone through all this, but there were challenging days, like very challenging days, where we would talk with our corporate group, and again, we'd get off the call and there was no playbook, there was no direction. So it was very tough. It was just a lot of open communication. And again, that open communication with our trade partners and as well as our clients. I don't know that I've necessarily been on a project, I won't say that, but this project has been very open both ways with the client during this outbreak. And I think that's helped us get through it. Again, it's our offsite storage agreements, those sorts of things, those take buy-in from both parties. You're paying your trade early, they're having the material sitting on site. It's not physically even in Kamloops, it's in Vancouver. But again, both us and our clients see the benefit to going that direction. So I think it's, if anybody could take anything from that, it's just the open communication and really just making sure that we're fighting for the same goal here. We want to succeed, but we need to send everybody home safely.
Okay, thank you. One other thing, during your presentation, you mentioned how you came up with solutions for like the concrete and everything else. Did you come up with anything else that you see moving forward that you could use in other projects to expedite timelines and to maybe move forward and have them finished in a quicker manner?
I think that the one thing, and it wasn't a direct innovation because of COVID, it was built into the project, but I think the modular construction, the offsite construction of our multi-trade racks was a huge benefit. I haven't done a full analysis of the total savings in terms of schedule on site, if there was any, because those things are being built months ahead of time, and you got to factor in that manpower versus the traditional manpower building. But what it did do is it reduced the number of workers required on a floor plate, and it allowed for a cleaner transition between those things going up and the walls being framed below, because they're up and they're complete, they're insulated, they're done, and that allows our drywaller to go and frame his walls as the only trade on that floor, versus getting your mechanical and electrical guys, you know, a week ahead of your drywaller, and he's framing up there with pipe on the floor and conduit on the floor and ductwork. He had the floor to himself with no material lying on the floor. And I think that that's an innovation that we'll continue to explore and probably expand outside of just those scopes.
I think as well, a lesson learned that we'll carry through with Ellis Don is the early procurement. We always, for as long as I've been building, we always, you know, talk about getting early procurement, and, you know, the superintendents are get it here so I can build it type thing. And on this project, we actually did it, but we put the horsepower, we put a lot of people on procuring. I mean, more than I've ever seen. Again, we really engaged with our consultants, and everybody bought into the idea that we needed to get things on, you know, on the block into production, because nobody knew when it would shut down. I mean, our elevators, this is the first project I think in my career where our elevators are here built and sitting. Like, yeah. It's just, but again, that came from really working hard with our consultants and our contractors and the shop drawings. I mean, we were pushing shop drawings and holding our team accountable. There was a meeting early on with our groups, and it was shop drawings were just, you know, taking their timelines and then going out. There was no sense of urgency. So I think we developed a sense of urgency and started trying to establish some pride in actually hitting your deadlines. If it's a 2-week, make sure it's back in 2 weeks and give yourself a day buffer. So, you know, that's going to be one going forward that, you know, we've talked about it for however long we've been building in this industry, but if you get it to site and you get it ordered up, you can build these buildings.
I think another early thing in those city discussions that we went beyond just understanding the equipment and the procurement to understanding the supply chain that went into that equipment. And so we weren't just looking at, you know, when can that equipment be delivered to site. We were understanding the materials that were required for that equipment and what type of supply chain disruptions we might see. Our metal cladding came out of Spain, for example, and when we were having moderate challenges with COVID, Spain was having unbelievable challenges with COVID. And so it was understanding, you know, is there a contingency plan for getting this material outside of Spain? Can we talk to the Spanish manufacturers and see what effect the COVID is having in their local area and where their materials are being sourced from? And so there was a focus that I don't think I've ever had on understanding the supply chain of where our equipment, with the components that made it up and where they were coming from.
That cladding is a great example. I don't know if Jordan is even necessarily aware of it, but we actually ended up securing a backup plan out of the States. It was going to be substantially more expensive, but again, it was a backup plan in case Spain did get shut down for any extended period of time. So it was thought like that. It was, you know, we saw areas within the world that were struggling, and we started to see if there were other options out there where we could get materials. So plan A, B, C, you know, as Z sometimes.
Yeah.
That's great. Well, Jordan and Levi, we thank you for your presentation. It was very informative, and I think we all learned something. We will be sending out, CHES BC will be sending out a small gift as a token of our appreciation to thank you for your time here today. We want to thank all those who have taken some time out of their building today to participate, or their work today to participate. And today's presentation will be posted on the CHES BC website for future review. And all of today's participants will be entered into a prize draw, and the winners will be contacted by CHES BC. So thank you everyone for your time, and have a great day.
Thank you.
Thank you very much.